Even more concerning is the fact that most people are unaware that their bathroom habits are already exhibiting warning signs of brain changes long before they notice any significant memory issues. Did you know that your morning hygiene routine may be subtly giving medical professionals early indications of dementia? In this video, I'll reveal the 5 crucial morning hygiene errors that neurologists immediately recognize as early dementia warning signs, along with a 6th that becomes dangerously common after 65. The frightening truth is that doctors can often detect cognitive decline months or even years before a diagnosis simply by observing changes in how you take care of yourself each morning. However, you must understand right away because recognizing these warning signs early could mean the difference between maintaining your independence or losing it forever. More significantly, I'll outline the easy adjustments you can do right now to safeguard your mental well-being before it's too late. Let me introduce you to Dorothy, a lively 68-year-old who took great satisfaction in her self-reliance and immaculate looks. Her daughter started to notice minor adjustments. When they eventually went to see a neurologist, the doctor identified these morning hygiene changes as early indicators of cognitive impairment right away because of the mismatched clothes, uncombed hair, and faint body odor that were totally out of character for her always put-together mother. "If only we had known what to look for," her daughter later said, "we could have started treatment so much earlier." The startling thing is that Dorothy had been exhibiting these warning signs for more than 7 months without anyone understanding what they meant. Could you or someone you love be exhibiting these same warning signs right now without realizing it? When was the last time you truly paid attention to your dental hygiene routine? Let's start with the first crucial morning hygiene error that doctors can spot right away: failing to clean your teeth or brushing them incorrectly. The truth is that most individuals simply ignore it until it's too late, yet changes in dental hygiene are frequently among the first obvious indicators of cognitive deterioration. Neurologists at Johns Hopkins Medicine have found a shocking link: patients who did not maintain basic dental care had a 3-fold higher risk of developing dementia. The brain pathways responsible for remembering multi-step processes like proper brushing technique are often the first to show signs of deterioration, says Dr. Sarah Michaels, a major expert in dementia studies. The 71-year-old retired accountant Alan's wife started finding his toothbrush completely dry some mornings, and other days she'd find the toothpaste uncapped or squeezed in the middle, something the orderly Alan would never have done before. When she gently asked him if he'd brushed his teeth, he would insist he had, genuinely believing it to be true. It wasn't until their dentist noticed increased plaque buildup and questioned his home care routine that they realized there could be a big problem. Here's what you must do beginning tomorrow morning. Put a basic checklist with the following procedures next to your bathroom sink. Applying toothpaste to the brush for 2 minutes and then completely cleaning it off might serve as a visual reminder to maintain good oral hygiene. Set up a dental mirror with adequate lighting so you can see clearly if you've missed any spots. If you start forgetting to brush or notice that you're having trouble completing the entire routine, don't ignore it, even if your brain is starting to struggle with sequencing tasks. This goes beyond dental health. It's a serious warning indicator that needs to be addressed right away by your physician. Do you still get complete dental care every morning, or have you observed any little adjustments to your routine? Don't wait until it's too late to correct this error. 2. Choosing mismatched attire or wearing the same clothes again and over again. Have you noticed that some clothing items are accumulating untouched while others are being worn repeatedly? Or perhaps patterns and colors that used to seem blatantly out of place now seem to work well together. These are not just fashion faux pas, they are possible warning indications that medical professionals can spot right away as early indicators of decreasing cognition. According to a study from the Alzheimer's Association, alterations in clothing patterns are directly linked to declines in the executive function regions of the brain. We're seeing concrete evidence of visual spatial processing deficits and executive function decline when patients start wearing mismatched clothing or the same outfits for days without noticing. Cautions Dr. James Rodriguez, a neuropsychologist who specializes in dementia. These changes frequently manifest 12 to 24 months before other more well-known symptoms. Think about Beatrice, a 73-year-old former librarian who was well known for her well-groomed look and organized attire, began wearing the same blue sweater every day, sometimes with designs that were entirely at odds, until her son noticed. When gently questioned, Beatrice was unable to comprehend his concerns because the outfit choices made perfect sense to her. This wasn't just a change in fashion preferences, it was her brain losing the ability to make visual distinctions and sequential decisions. He discovered many unworn clothes with tags still attached in her closet, while a small selection showed signs of constant reweaving. This is what you need to do right now. Establish a basic system of matching clothing on separate hangers, complete with all necessary accessories. Take pictures of these full ensembles for reference, and even more importantly, properly identify the closet divisions. Create a transparent procedure for handling used clothing. Because worn items are the most visible or easily accessible, a dedicated hamper with a sign reading "worn items" can stop the common practice of reusing clothing. If you find yourself having trouble telling the difference between clean and worn items, or notice that you're wearing the same outfit over and over again, this isn't just a strange habit, it's a warning sign that needs to be addressed right away. Have you recently noticed any changes in the way you choose or handle your wardrobe? Ignoring these warning signs could have serious consequences because they are related to your mental health rather than fashion. Error 3. Having trouble controlling the water temperature or shower routine. When was the last time you gave your shower routine any serious thought? Most people don't realize how complicated it is because it's such an instinctive process, but neurologists are aware of something horrifying, that one of the most evident early signs of cognitive decline is taking a shower, which manifests long before more overt memory issues. Bathing difficulties are highly correlated with the early stages of dementia, according to medical research from NYU Langone Health Center for Brain Health. The shower routine requires executive functioning sequencing, temperature regulation, and risk assessment, all of which are controlled by different brain regions that are frequently affected early in dementia. Michelle Taylor, a neurologist who specializes in cognitive disorders, explains that when patients start having trouble taking a shower, we're seeing real-time evidence of neural pathway deterioration that demands immediate attention. Examine the circumstances surrounding the death of 75-year-old retired engineer Nelson. His wife noticed that he had begun taking unusually short showers, sometimes coming out still soapy or with shampoo in his hair. When she brought it up, he became unusually defensive, and she later found that he had stopped taking regular showers entirely, citing excuses such as being too busy or not feeling dirty. The truth was more concerning. The multi-step procedure had grown too complex for his developing brain. By the time they sought assistance, he was unable to keep the focus that was before automatic. Here's what you need to do now. After Nelson's cognitive evaluation showed moderate impairment that had been growing for months. Make your shower routine easier by posting a simple weatherproof checklist with the essential procedures inside the shower. Install a temperature-controlled shower system to avoid hazardous variations in water temperature. In order to create a routine your brain can follow even when executive function starts to deteriorate, it is crucial to establish a regular showering schedule. If you find yourself getting confused about the order of washing, forgetting whether you have shampooed, or avoiding showers entirely because they seem too complicated, this is not normal aging. Rather, it is a serious warning sign that needs to be evaluated by a doctor right away. Have you noticed a recent decrease in the amount of time you spend in the shower, or a lack of clarity on the processes involved? Your bathing habits may be disclosing important information about the health of your brain that you cannot afford. Have you noticed a shift in the way you maintain your appearance as a result of ignoring mistake 4 and ignoring basic grooming? These seemingly insignificant grooming changes, like not having your hair as neatly combed, having longer nails than usual, or having irregular shaving habits, are not just about appearance. They could be warning signs of serious cognitive decline that doctors can spot right away. According to research from the University of California's early-stage dementia and neglected personal grooming are directly correlated, according to research from the Davis Alzheimer's Center. According to eminent neuropsychiatrist Dr. Jonathan Wilson, the brain pathways in charge of starting and finishing multi-step self-care routines are among the first to be impacted by neurodegenerative changes. When a previously well-groomed person starts to neglect these habits, according to our longitudinal studies, which reveal that minor grooming changes frequently occur 15 to 24 months before diagnosis. Usually their brain's incapacity to sustain these intricate patterns not simply letting themselves go. When her daughter noticed that her mother's once flawless manicure was constantly chipped, her hair was frequently uncombed on one side, and her makeup was applied unevenly, Vivian would become defensive or change the topic when gently questioned. The truth was devastating. These weren't conscious choices. Rather, her brain was losing the ability to recognize these grooming needs or complete the necessary steps. By the time her family recognized these as warning signs, Vivian's condition had significantly worsened and wasn't just aging. Here's what you must do starting today. Make a straightforward grooming checklist with precise instructions for taking care of your hair. For nail care and facial grooming, keep necessary equipment visible and labeled if necessary. Even more important, set up a regular routine for more involved grooming procedures like haircuts and nail trimming, and use calendar reminders to keep things consistent. If loved ones remark on changes in your appearance, or if you find it difficult to maintain grooming standards that were once automatic, don't ignore these observations if you hadn't noticed yourself. They are more than just aesthetic issues. They could be indicators of cognitive decline that need to be evaluated by a doctor right now. Are you still keeping up your usual standard of personal grooming, or have some elements started to deteriorate without your full awareness? The response can provide important details about the condition of your brain that you cannot afford to overlook. 5 people who misuse personal care items. Everyone makes mistakes from time to time, but have you ever been briefly perplexed about which bathroom product to use for what purpose? For example, have you ever squeezed toothpaste into your hairbrush or used shaving cream as face wash? Doctors quickly identify frequent perplexity with personal care products as a significant indicator of cognitive deterioration. According to Stanford University's research on early dementia indicators, product abuse frequently manifests 12 to 18 months before to a diagnosis. The brain's ability to correctly identify objects and their purposes requires complex neural pathways, says Dr. Rachel Thompson, a neurologist who specializes in early dementia detection. When patients start regularly misusing personal care items, we're seeing real-time evidence of visual processing and executive function impairment. These aren't just careless errors, rather they provide insights into how the brain processes information. Harold, a 74-year-old retired educator, and his spouse observed oddities taking place in their restroom. When she would mention these mix-ups, Harold would dismiss them as silly mistakes or deny they ever happened. It wasn't until a neurological evaluation that they realized these weren't random errors, but rather consistent patterns indicating significant cognitive changes that had been developing for more than a year. Here's what you need to do right away. She would find the mouthwash in the shower, discover shampoo had been used as body wash, or see toothpaste applied to a hairbrush. Make your bathroom simpler by getting rid of stuff that aren't needed and marking important items with both words and graphics. Establish specific areas for various product categories. Dental care in a single well-defined area, hair care in a different. To cut down on confusion, think about utilizing multi-purpose items. Most importantly, medical doctors recognize these specific errors as serious warning indicators that require immediate evaluation. So don't write them off as normal aging or forgetfulness if you find frequent confusion with personal care items. These mistakes aren't just careless ones, they could be your brain sending urgent signals that something is changing. For example, have you ever walked away from the sink and realized minutes or even hours later that you left the water running or started brushing your teeth, only to find yourself in another room without finishing? These aren't just senior moments. They're potentially serious warning signs that doctors recognize as indicators of cognitive decline. Have you recently been confused about which product to use for what purpose or discovered items in unusual places without remembering how they got there? Task completion failures, especially with basic behaviors like restroom habits, are substantially correlated with early-stage dementia, according to study from Boston University's Alzheimer's Center. We're seeing concrete evidence of executive function impairment when patients consistently leave tasks unfinished, water running, cabinet doors open, towels on the floor, cautions Dr. Samuel Cooper, a top researcher in cognitive evaluation. The brain's capacity to sustain attention over a whole sequence is deteriorating, and these failures frequently manifest 12 to 24 months before more obvious symptoms do. Geraldine, a 72-year-old retired nurse, had always been extremely organized. When her husband started noticing that the bathroom light was on all day, that faucets were left running, and that wet towels were on the floor, she had no memory of leaving things unfinished. This was a serious warning sign that they initially dismissed as simple forgetfulness, but by the time they sought help, her cognitive assessment showed moderate impairment that had been developing for almost 2 years. Here's what you need to do today. Install automatic. Turn off faucets that shut off after a certain amount of time. If at all possible, place eye-level reminder signs next to sinks and showers that say simple things like turn off the water and take your medication. Even more important, have a bathroom exit routine checklist posted on the door with simple phrases like turn off water and take your medication, and water off, lights off, towel hung up. This will help you and your loved ones develop the habit of checking the bathroom before you leave if you or they notice patterns of unfinished tasks or safety issues like don't wait. Neurologists recognize these behaviors as serious warning signs that require immediate medical attention. Are you completing all of your bathroom tasks completely? Have you noticed instances where you leave without finishing what you started? Your response could provide important information about your brain health that needs to be addressed now before it's too late. These 6 morning hygiene errors may appear insignificant at first glance, yet they are strong warning flags of cognitive deterioration that physicians may spot right away. If you've noticed any of these warning signs in yourself or someone you love, don't wait until they become impossible to ignore. Remember Dorothy, whose family wished they had recognized these signals months earlier. Now that you have the knowledge they didn't take action, you can schedule a cognitive assessment with your doctor and put the simple strategies we've discussed for each warning sign into practice. Early detection can make all the difference in maintaining your independence, starting effective treatments, and possibly slowing progression by establishing simple systems, visual cues, and consistent routines. To ensure you never miss our life-changing health information, press the like button now and leave a comment letting us know which of these warning flags startled you the most. You can also subscribe to our channel and enable notifications. Sending this video to a loved one could be the most significant thing you do for them today.